Now, how do you diagnose acne vulgaris? Basically, in my clinical practice, when you see a patient, usually on clinical diagnosis, something we call as an inspection and palpation technique, we can usually diagnose acne vulgaris. But sometimes it so happens, in spite of diagnosing and treating, we encounter problems where the treatment becomes very difficult. In such cases, we do certain investigations besides clinical examination, like we do a culture sensitivity of the blood to rule out what exact pathogen that is responsible for this acne vulgaris. The other investigations that we do is we do a complete blood count of the person. And we also do something called as a hormonal assay to rule out any hormonal influences that may cause this acne vulgaris problem. The other investigations that we do are specific and subjective to every individual patients. We also do an ultrasound examination to rule out PCOD problem, that is called as polycystic ovarian disease, that usually is one of the main culprits in menstruating women, and their periods don't come out regularly and they encounter this problem called acne vulgaris. Now I will discuss with you how do you treat acne vulgaris. Before I start my subject on how do you treat, I request all my viewers that don't self-medicate yourself. Always consult a dermatologist before you start treatment. Don't treat yourself personally, becoming a doctor by yourself. Always take expert advice from your dermatologist before you start any kind of treatment. Normally, what we do is that the treatment is divided into two phases. I divide my treatment into two types. One is an invasive treatment and non-invasive treatment. So before I begin my subject on how do you treat acne vulgaris, I'll discuss with you all the non-invasive method of treating. Usually, my advice is that keep your face and body clean and tidy. The culprit, as you all know, is caused by a bacteria. So I advise all my subscribers and viewers to practice clean skin technique. Keep your skin clean and dry by using a very good neutral pH Syndet bar soap. Any soaps that contain chlorhexidine, triclosan, aloe vera, allantoin are very good for your skin. Try to use these soaps after taking advice from your dermatologist. So the next important thing is that we use something called as retinoids to treat this hypersecretion of sebum below the skin. Retinoids like isotretinoin, tazarotene, and benzyl peroxide are the drugs sometimes that we use basically after examining the patient, checking the patient's blood pressure, height, weight, and many other things come into consideration before we start a particular drug on a patient. So don't self-medicate yourself. Once again, this is my advice. So these drugs basically are a group of drugs called as retinoids. These drugs directly act on the sebaceous gland. So this is the sebaceous gland I discussed with you last time. This is the sebaceous gland which is attached to the hair follicle. The sebaceous gland secretes sebum, and these retinoid group of drugs directly act on the sebaceous gland, reducing the oil output from the body. Sometimes we use antibiotics like broad spectrum antibiotics, tetracycline, chloramphenicol, doxycycline, and sometimes we also do a culture sensitivity of the pus and the blood to determine which is the best antibiotic that the patient can use. So antibiotics varies from person to person and it depends upon cases. Antibiotics are basically case subjective, and your doctor will be the best person to advise which antibiotic will be the best for you. We also use azelaic acid and salicylic acid preparations to treat acne vulgaris. Sometimes we use Dapsone 5% local application as a topical application medicine. Also, in sometimes patients who have hormonal insufficiency and hormonal imbalance can be corrected by using certain anti drugs that in fact stop the upsurge of certain hormones that causes acne vulgaris. The non-invasive techniques of treating acne vulgaris are basically use of laser, and sometimes we do something called as subcision and beneath the skin to remove the pus and sometimes to remove the whiteheads. And we also do something called as drainage and extraction, which has been done by a good dermatologist to remove sometimes the pus that is collected below the skin surface. Sometimes if there's an abscess, we do a small incision and drainage, and a pustule can be easily drained by using this particular technique. So these are the different modalities of treating acne vulgaris. First, the non-invasive technique is by the use of antibiotics, specific drugs, and topical agents like retinoids and local antibiotics on the skin. The invasive technique is by the use of light therapy, sometimes lasers, sometimes subcision techniques, incision and drainage. So this is my second talk on my acne vulgaris. So I hope that all my viewers enjoyed my talk, and if you do have any questions, do comment and write back to me in my comment section. And thank you once again for subscribing to our channel Prabhu Evans Healthcare and Lifestyle. Continue to view my channel. Every week I will post certain important topics that you like, and in case if you like any particular subject, do comment and I will talk and reply you back. So in my next topic, I will discuss the different tips and the different ways that how beautiful your skin can be maintained. Tips for beautiful skin. This is my part 3 on my topic. I hope you all enjoyed my topic, and I hope to see you on my next talk. Thank you very much.